campaign is to bring a dose of reality into the political discussion. So I could give a 10-hour speech, and that's fine, or not so fine. But what is important is that we hear from people and their own life experience. And we don't hear that often. You know, when you turn on the TV, you hear a lot of stuff, but you don't really hear about what's going on in people's lives, the pain that people are experiencing, the challenges that they face, and a discussion of how we might want to address those issues. And that is what we're going to do today. So we have four wonderful people here. We're going to talk a little bit about what's going on in their life. And then we'll just have a discussion. You can ask me questions. I'll ask you questions. But today we're going to focus on a couple of issues, but we can go any place you want. But I want to focus on healthcare and prescription drugs, okay? And those are two issues that I think do not kind of get the attention that they deserve. And before I introduce our panelists, I want to just throw out some propositions to you. And issue number one in terms of healthcare is, as a nation, we have got to make a very fundamental decision. Now, there are people on both sides of the issue, but question is, do we believe that healthcare is a human right? Or, all right, okay. And I think most Americans do believe that. We have the absurd situation today that you have 34 million Americans who have no health insurance at all. And I want you to think for a minute. And we throw that number out a lot. And then we have more, even more than that, who are underinsured with high deductibles and high copayments. What does that mean? What happens if let's say you have insurance. Now, insurance is a big word because some insurance policies are pretty comprehensive. Some insurance policies are pretty bad. They cover very little. So what happens if you have an insurance policy with a very high deductible or very high copayment and you don't have a whole lot of money? You're here in Iowa and you're making $9, $10 an hour. What happens to you? Go. Well, raise your hand and let's have that discussion. Ma'am, stand up.
Essentially, you have to help them.
Right. So your point is you can technically have insurance, but it doesn't mean anything if you can't afford to go to the doctor. How many people are in that position here? Any people? Okay. So you have insurance, but it is insurance which requires you to take a lot of money out of your own pocket if you're going to go visit a doctor. All right, let me ask you another question. What happens if, God forbid, somebody in a family gets really sick and ends up in the hospital? What do people worry about? Well, maybe people want to tell me a little bit about that. What happens? Yes, ma'am.
I don't receive any paid time off, so thank you. I don't receive any paid time off, so if my daughter has arthritis and she needs a total jaw reconstruction surgery because her jaw, and she's going to turn 14 in July. And so that's going to be a long time in the hospital, but I will miss probably a whole month of work with no PTO. Thank you.
And what happens when you miss a whole month of work? What happens to your life?
I won't pay my bills. I make under $30,000 a year.
All right. And if you don't pay your bills, what happens to your life? All right.
Homelessness.
All right. You see, this is, what's your name, ma'am?
Tiffany Campbell.
Cindy. All right. That story is the story of millions of people in this country, and it's not a story you see all that often on TV. It's the vicious circle of having to pay off a health care bill, or maybe not, and maybe being hounded for the rest of your life for that bill if you don't have the money. All right, other examples. Yes, ma'am. Can we get a mic? Hold on for a second. We're going to, Miss Thea is going to be running a little bit ragged here. This is Misty's exercise for the day. Right? Mister, give it. She can hold it in her hand. Let her hold it. Yeah, hold it close to your mouth. Yes.
My mother was recently diagnosed with brain tumors, and she is unable to obviously work. She's been in and out of the hospital, I don't know how many different times over the past year, And my dad is also on disability because he's an amputee. And they are about to ready to lose their house because they either have to worry about paying for my mother's medical bills and prescriptions, or, you know, food on the table, or their house.
I'm sorry, your name is?
Charlotte.
All right, Charlotte just told us that in the wealthiest country in the history of the world, her parents may have to lose the house. How long have they been living in that house?
25 years.
25 years. So you got elderly people been living in a house for 25 years, and as happens, they're dealing with illness, and after living in that home for the good part of their lives, they may have to lose that home. Other stories. Anything else about illness? I see a hand over there.
My roommate is permanently disabled from complications during his kidney transplant surgery. He's on Medicaid disability or Medicare disability, and he's also got, I think, like a Medicare Advantage plan. But even with that, he still has to pay upwards of $8,000 in medicine and co-pays and everything else. And so even though he's getting Social Security disability payments and he has his disability insurance, he's constantly in debt, and it's just a constant headache for him all the time.
Okay, thank you. Anybody else want to share an experience? Okay. All right, let's get to, I think you've heard the four comments that you've heard kind of tells it all. And that has to do with getting our priorities right as a nation, in making sure that people do not have to go through the experiences you've just heard and the experiences you're going to hear in a moment. So let me begin by introducing the panelists, and we're going to begin with Peggy, I'm going to mispronounce, Gallaty? Gallaty. Okay. Peggy, you want to begin?
Sure. My name is Peggy Gallaty, and I'm proud to be supporting Bernie for president. I've lived in Iowa since 2007, and I have many connections to how seniors are mistreated today. I'm disabled with major joint issues, and I've been living on less than $20,000 a year. Works out to about $9 an hour if I worked full time. I used to make $27 an hour. In September, I will turn 65, and my birthday gift is getting kicked off Medicaid. I will be considered retired instead of disabled, and with this change, I lose my disability and Medicaid, my dental and vision coverage. My monthly costs are going to increase significantly. Right now, the state pays about $175 a month for my Medicare Part B and D premiums. Medicaid already paid $500 so far this year just for my out-of-pocket prescriptions. And I don't take opiates. And right now I pay $60 to $80 a month for out-of-pocket medical costs plus glasses. But when I turn 65 in September, here's what changes. I will have to pay the $175 a month for the Medicare Part B and D premiums, and my out-of-pocket medicine costs will increase by $100 a month. I cannot afford that. One prescription that will help my pain will go up to $90 a month, and I'm going to have to go without that medicine. That's not right. And I'm not even allowed to grow my own medicine in this state. On top of that, and by the way, I testified before the pharmacy board, and technically they approved it. It was about 8-10 years ago. They approved it unanimously, and technically that should be legal. But anyway, I digress. On top of that, I'll have to buy a medical policy that will cost another $140 a month. In total right now, I pay $60 a month for my health care and my dental care. But after my birthday, it goes up to $500 a month just to keep the same care I receive right now. And if I paid $200 a month, if I made $200 a month less, I would get full Medicaid, and nothing would change. Adding stress to all this, my parents, who I've been taking care of, are now in wheelchairs in a nursing home. Their out-of-pocket medical expenses with Medicare Part D, Part B, and Part C was a whopping nearly $279,000 last year. And in that, their meds went up over 1,000 and nothing changed. I have seen firsthand how this country's turned its backs on seniors and left people with disabilities and in need of medical care high and dry. In fact, before Obamacare, I had a friend who had cancer and she died because Obamacare came too late. Our country's not taking care of its seniors with dignity and respect. We need leaders who are willing to stand up for people in all walks of life and ensure that they have the net resources necessary to live well. There's no reason we shouldn't provide dental, vision, and long-term care for seniors. Health care is a human right. Amen. As Martin Luther King Jr. once said, the true measure of any society can be found in how it treats its most vulnerable members. $20,000 a year is not treating our seniors with dignity. And I won't even mention the trillions the GOP stole, but anyway. Having to decide between medicine or your electric bill or food is not living with dignity. I always have to have a roommate. I can't afford to live alone anymore. Turning 65 should be a milestone, not the day you lose your health care. That's why I support Bernie Sanders and his Medicare for All plan that would include vision, dental, hearing, and long-term care. Feel the burn!
Thank you very much, Peggy, and I'm going to get back later on because I want to ask you a question. You know, we don't ask that question often enough. How in God's name in this day and age does somebody live on $20,000 a year? Okay. All right, I want to get now to Carl Bergstrom. Carl, do you want to say a few words?
Yes, thank you very much, Senator. Hello, my name is Carl Bergstrand. I'm from Davenport, Iowa. I'm the son of a tenant farmer from just down the road in Bondurant. I graduated from Drake University in 1971, worked for 20 years in pharmaceutical, medical supply companies, and owned 3 businesses after that. As I approached my mid-60s, I began receiving my Social Security and Medicare, and quickly realized I would need to work part-time to help make ends meet. So I'm currently a private property manager for a building located in the East Village of Davenport. Medicare really changed my quality of life with a program built on improving my health. My health care provider started with a plan to actually help me prevent the heart disease and life-threatening other diseases. My cholesterol issues were reduced, my blood pressure was finally lowered and controlled. But other health complications arose, namely the development of arthritis in both hips. Soon I was losing my ability to walk. My first hip replacement was on October 24th, 2018, and my second hip surgery, February 18th. By April of this year, I was walking and climbing stairs pain-free and riding my bicycle. When the bills came due, I was totally surprised that Medicare would be paying 95% of the bill. I was elated. Medicare saved me from a life of pain, confinement to a wheelchair, and basically, Medicare saved me from homelessness. But Medicare doesn't cover dental. Throughout my life, I've always had problems with my teeth and very large dental bills. But I'm lucky. One of my sons became a dentist. I was able to go to him, and I've saved over $30,000. Really blessed. I started going to him in the junior year. I was his first patient, and hopefully I won't be the last. Not everyone has a son who's a dentist, and no one should have to choose between dental care and food on the table. We all deserve the right to good dental, good vision, and hearing care as we progress and enjoy our later years of life. I believe in Medicare for all that includes dental, hearing, and vision. And back in the 70s, when I was 25, I had the opportunity of attending a nursing home convention and got to listen to a speech made by Maggie Coons, who was the founder of the Gray Panthers. She was actually the leader that went parked wheelchairs on the train tracks in Pittsburgh and got senior discounts for trains. She was a true pioneer. Anyway, I remember like it was just yesterday. She told us young and old have much in common. They both wear diapers. They're both on drugs. And they both have trouble chewing. And both have middle-aged people, their children, running their lives. Do I worry about the future? You bet. There is no guarantee about Social Security. Our health is not guaranteed. And Bernie Sanders is just the man to fight for senior human rights of dignity and respect. In my mind, Bernie is fighting for all of us, and I'm proud to support Senator Sanders for president. And as Bernie says, I believe when we stand together, when we share the vision that government should work for all of us, there is nothing we can't accomplish. Thank you.
Thank you very much, Carl. Carl raised an issue that I have talked about for a long time, and that is the issue of dental care. Didn't get a whole lot of discussion. The truth is, dental care in this country is very, very expensive. And the truth is that a lot of people can't access the dental care they need. Who wants to say a few words about dental care? Is there a problem around here? It's a problem in Vermont. Yeah, ma'am. Misty, can we get a... All right, wait for Misty.
I've had quite a few problems with my teeth over the years. In college, I probably didn't take care of my teeth as well as I should have, but that's besides the point. I was on my mom's coverage at the time, and they only allowed surgery on one tooth per year, basically. And it was 2 teeth. So not only was I paying for the one tooth, I think it was like $100 just to allow the surgery to take place, like a copay, and then it was $2,000 out of pocket for the second tooth. About 3 years later, I ended up with a problem with the same root canal. They don't really do lawsuits with teeth because anything can happen. So I went in, endodontist, went in and removed all of that and redid it. However, I didn't have insurance at the time because I was in between jobs. And I thought to myself, well, you know, technically, in my head, dental and medical are pretty much kind of the same thing. They should really be covered under the same plan. It's
And
not.
you learned
it
the
doesn't work that
painful
way.
lesson that was not the case.
$2,000 later, I got another tooth redone. I just had another tooth surgery because the same problem occurred with the opposite tooth, and it was $600. I have insurance now. It was $600 out of pocket before they'd even cover it.
With
Yes.
your insurance, yeah. Okay. All right. Other thoughts on dental care? I see a woman. Sorry, Misty, to run your ragged here, but we're doing this quite intentionally. This is. Oh, all right. Now we got 2. Oh, okay, now we're in good shape. Misty, why don't you get to the other side here, and Evan will stay there.
My husband's staring at me like I'm crazy because we have good dental care. We're blessed. I have good teeth. I'm also a nurse. Dental hygiene, dental health is key to the heart, to the whole health of the body, and many, many, many people do not understand that. And I am a school nurse, and I see kids who have teeth rotting away because they're drinking sugared drinks, and it's something we need to educate on, and then they have no health care to cover it. And I really wonder about these kids' hearts, too.
Is that still the case, that you see kids, young kids whose teeth are rotting? All right, let me tell you a story. I mean, and how I think that's how I got involved in the issue of dental care. I moved a long, long time ago to a very small town. It's a town called Stannard, Vermont, in the northern part of the state. Very poor town, as it happens. And right across the road from me was the road commissioner. And his kid, he had a kid, I'm guessing 9, 10 years of age, and I had never seen anything like it. His teeth, at the age of 9 or 10, was literally rotting in his mouth. We have come a long way actually in Vermont, but I'm surprised that still exists right here in Iowa, that we have children who have teeth rotting in their mouths. All right. One of the things that we've done in Vermont, and I'll get into that later, is we have expanded, and we do this nationally, as part of the Affordable Care Act, didn't get a whole lot of attention. Congressman Clyburn of South Carolina and I expanded community health centers to the tune of about $10 billion. And what community health centers do, I don't know, do you have community health centers around here? What they do, it's called a federally qualified community health center. It's a poor name, but what it does is it says that anybody in the community, regardless of income, can walk in the door. And when you walk in the door, it's a sliding scale basis. Medicaid is certainly welcome. Medicare is welcome. Private insurance is welcome. You get primary health care. You get dental care based on your ability to pay. You get mental health counseling, which is another big issue I think we should probably talk about, yes? And then you get low-cost prescription drugs, which is another issue we'll talk about, all right? That's what community health centers do, and we almost, I think, doubled the number of people getting into community health centers. All right, I want more words on dental care. Is that an issue that we don't talk enough about? Anything else people want to add to that discussion? Yeah, see a gentleman over there.
Yeah, hi, I'm Aaron Humphreys. I grew up in poverty in rural Indiana, and when I was in high school, while eating something, my tooth exploded effectively. My parents couldn't afford any form of dental, so effectively it just went untreated. It wasn't until I was approximately 30 that I had any form of treatment. When I went in, that was when I first, by the way, had dental insurance. To have it treated, it turned out that my entire jaw had become infected, and that if I did not immediately have it treated, I would be killed, as it would infect my brain. So even though I did not have the finances effectively to pay it, I had to pay for it or die. So,
All right, that's exactly the point that the nurse made. All right, that in fact people have died from infections that started in their mouth, went to their heart, their brain, or elsewhere. Dental care, other thoughts, experiences? I see a hand over there.
Thank you. Thank you for taking my question, Senator Sanders. Actually, you know this woman who will be testifying next June 12th in support of the Medicare for All bill, Rebecca Wood. So I'm going to tell Rebecca's story. She had her daughter, Charlie, at 26 weeks early due to preeclampsia. And Charlie was born with a host of complications and is now a living pre-existing condition. But she's now just turned 7 and is healthy. But when she was younger and going through some therapy treatments, she didn't want Charlie to miss important developmental treatments. So Rebecca forestalled a dental procedure whose cost was put towards Charlie's ongoing medical care. When a gum infection spread and cut off Rebecca's ability to breathe, the next day she underwent a 6-hour operation to remove her teeth and have her jawbone scraped. And this was all done under local anesthesia because Rebecca couldn't afford to be put under.
Okay. What a horror story that is. All right, let me get back to the panel. And let's go to Kathy Frisley. Kathy?
Hi. Closer. Is this okay?
Hold that mic close to your mouth.
Okay. Hi, my name is Kathy Frisley. I'm a 79-year-old widow. I'm a mother of 3 living boys. I'm a grandmother to 6 truly great young adults. And I'm a great-grandmother to 4 of the sharpest little kids you've ever seen. I live in rural Iowa, and this healthcare situation in this country is pathetic, and I don't even engage in discussions with it because I get so angry. My husband, Mike, did hard physical work during his productive years.
Hold that mic close to your mouth. I know, it's hard to do.
Okay. He was in much physical pain prior to retiring and had back surgery in 2009.
Well, there was relief at first. He soon had as much pain as he'd ever had due to a lousy job of surgery. We saw a pain doctor, and Mike was prescribed a low-dose opioid, which provided some relief, but a big side effect for him, and I don't know if this is true with everyone, but he was constantly fighting sleep. He couldn't sit in his chair without dropping off. Approximately 4 or 5 years ago, that same doctor switched Mike to a new pain relief medication, as we were all learning about the risks of opioids at that time. We filled the prescription for $30, and it worked very well. It was very effective without that side effect of drowsiness. When we went for the refill, however, the clerk asked if I was going to pay all at once. Red flag. When I asked why that would be necessary, she said the cost had gone up to $600 for 30 pills, the same 30 pills. We didn't refill that prescription. Between Mike's Part D for the, Part D was for the drugs, and Mike's charges at the pharmacy, we were already paying approximately $200 a month for his meds to fight high cholesterol, high blood pressure, and diabetes. Prescription drugs should be free. We need them to live. It's not, something frivolous. While Mike's back pain, wasn't a life and death situation, it would have improved the quality of his life immensely. All people, including seniors, deserve to live in dignity. Our current health system is broken. There are over 500,000 people in Iowa who are 65 or over, and 35,000 of those are seniors who live in poverty. That's wrong. 151 seniors live with a disability, and 54,000 need help to live independently. Most people my age are on fixed incomes. We shouldn't be forced to forego pain meds because they shouldn't cost $600 a month. That's the bottom line. We shouldn't have to worry if we can afford long-term care. We need to take care of those who can't take care of themselves. And I just thought of something else, thank you, that I need to say, because I get this a lot. We have a lot of Republicans in my family, and to those people who say or think that no one should receive anything without working for it, my response is, do you think that maybe over $1 million they could pay a much higher rate of income tax than someone who gets an hourly wage? And the other thing that I feel is, you don't know what goes on in everyone's life. You don't know who's disabled or who can't work. It's just not putting a judgment on people. And too many people do that. Okay, where did I leave off? Bernie Sanders understands this. His Medicare for All plan includes dental, hearing, vision, and long-term care, all these that have been mentioned. And he has a plan to expand Social Security so we don't have to make a decision like food, what's going to be food on the table, or do I buy the drugs? Bernie believes that all people should live with dignity. That's why I support Bernie Sanders for President of the United States. And there's one more thing I want to say. I first heard this man speak, and I believe it was the fall of 2015. And I've never gone to a political person. I'm an old woman, and I just don't like to listen to them. They blow their own whistle, and they tell crap that they know is not going to happen. So when I went over to Waterloo and heard him speak for the first time, I came home and I told my husband, this man says what I have been screaming in my head for years. And I have been on the Bernie train ever since.
Oh, nothing I can say to top that. All right, Kathy raises an issue that is on virtually everybody's minds, and that is the high cost of prescription drugs. Okay. Question. If you go into your pharmacy tomorrow, is there anything to stop the drug companies from having doubled or quadrupled or increased the cost of your medicine as high as they want? Nothing. In other words, right now, the drug companies can charge you any price they want, and they do. Some of you may know, and some of you may not know, that last year, the top 10 drug companies in this country made $69 billion in profit. $69 billion in profit. Meanwhile, in Vermont and Iowa and all over this country, senior citizens are cutting their pills in half, which is a bad thing to do because they can't afford to buy the medicine that they need despite Medicare. And this is really crazy, all right? Kathy talks about a broken healthcare system. This is, I think, what she's talking about. Today in America, 1 out of 5 people who get a prescription from their doctor cannot afford to fill that prescription. All right? Think how insane that is. You are sick. You go to the doctor. The doctor makes a diagnosis, writes out a prescription, and you can't afford to fill that prescription. So what happens to the person who is sick who can't afford to fill that prescription? What's going to happen? They get sicker. That's brilliant. Or maybe they end up a week later in the emergency room at a very expensive cost to the healthcare system. Or maybe they even end up in the hospital. Or sometimes they will die. Truth is that about 30,000 Americans die every single year because they are uninsured or underinsured, something we don't talk about very, very much. So in terms of the drug companies, I want to tell you a story. All right? I'm into storytelling today, for better or worse. About 20 years ago, when I was in Congress, not in the Senate, in northern Vermont, there's a town called St. Albans, and it's a working class town. And in that town and in that county, we assembled a number of people, mostly women, who were struggling with breast cancer. And we got into a bus, and we went, 50 miles north into Montreal, Canada. Why did we go to Montreal, Canada? Anyone know? Yeah, it wasn't sightseeing. And we had arranged this. My office had arranged it. We went in there, and I'll never forget this as long as I live. These are women, working class women, struggling with a life and death issue of breast cancer. We walked into the pharmacy there, and they bought what was then a widely prescribed breast cancer drug called tamoxifen. I don't know if that means anything to anybody. And at that time, now we're talking 20 years ago, they paid 1/10 the price that they were paying in Vermont or in America. 10% for exactly the same pills and the same bottle made by the same company. It's not generic. Exactly the same product. And that is true all over the world. There are people who go to Europe to buy low-cost medicine because it costs a fraction of what they have to pay in the United States. Meanwhile, our friends in the pharmaceutical industry, who may be the greediest, there's a lot of greed going on in corporate America. Trust me, I deal with it every day. Whether it is Wall Street, whether it is the military-industrial complex, whatever it is, there's an enormous amount of greed. But I got to think that maybe along with Wall Street, at the very top of that pyramid are the drug companies, who have spent hundreds and hundreds and hundreds of millions of dollars in lobbying and campaign contributions to make certain that they can charge you any price they want for the medicine you desperately need. Now, I don't know how these guys go to sleep at night and what kind of conscience they have, knowing that there are people who are dying or are becoming significantly sicker because they cannot afford outrageous prices for prescription drugs. I don't know how these guys sleep, but they do. So let me just give a promise to you, and that is when we are in the White House, we will cut prescription drug cost in half in this country. And that is not a radical idea. Oh, well, he's just saying this is a radical idea. All I'm asking, this is not radical, is that we don't pay any more than they pay in Europe and in other countries around the world. And also as part of the Medicare for All system, we will make sure that everybody in this country who needs medicine will get it regardless of their income. Okay, our last panelist is Ramona Chavez Lopez. And Ramona, are you going to speak in English or do we have a translator for you?
I have translation because I feel more comfortable.
Okay, and here's your translator, see?
I speak the language, but I feel
Good,
comfortable
good.
explaining what I
See,
want to say.
all right, so Misty is not only running all over the floor here, she's going to be a translator as well. A woman of many talents, all right.
Buenas noches y tardes para todos ustedes.
Good afternoon, everybody.
Yo soy Ramona Chávez López y trabajo como Home Health Aide para esta comunidad por un promedio de 15 años.
My name is Romana, and I've worked in home care health for the last 15 years.
12 casi para Iowa Home Care y tengo que lidiar con mucha gente, visitar de 9 a 10 familias, clientes diario.
So I work for Iowa Home Care, and on a daily basis, I visit 9 to 10 families and take care of them.
Mi día empieza a las 5:30 de la mañana y termino en veces hasta las 8 de la noche o 9.
My day usually starts around 5:30 a.m., and sometimes I end work around 7, 8, 9 o'clock p.m.
Amo mucho este trabajo. Esta comunidad para mí me ha dado mucho.
I love my job, and this community has given me a lot.
Cuando yo vine aquí, sentí que no, me sentí bienvenida.
When I came here, I always felt very welcome.
También les dije que que no era parte del problema, sino parte de la solución, porque en mi comunidad de inmigrante hispana o Spanish speaking es grande. En la MHS me sorprendí en las graduaciones, un promedio de probablemente un 65% eran hispanos.
So I am not a part of the problem or a solution, and I come here as a part of a large Hispanic community. And most recently, I was very surprised by the people who graduated at MHS. A large majority of them were Hispanic.
Yo trato con estos clientes cada día y hay veces que su retirement money is not enough.
I work with these people every day, and sometimes the retirement money is not enough. She's talking about the families, the individuals that she goes to their homes and takes care of them.
Hay veces que he tenido que parar a la casa de compasión y agarrar free bread.
A lot of the times I have to stop at the Compassion House and get free bread for them.
También en veces le llamo a mi esposa y le digo cocine algo para esta persona porque necesita poner su insulina.
Sometimes these seniors, I have to call my husband and ask him to cook something for them so I can take it to their home because they need food.
También el problema de salud, si alguien agarra $1,100 a month, no es suficiente y esta persona tiene 75 años.
For example, a client that I work with who's 75 years old only has an income of $1,100.
And this is the gross income. When she applied for food stamps, it's not enough. So, cuando ella aplica por estampillas de comida, cuando ella aplica por estampillas de comida, solo le dan $75 porque tiene 1,100 al mes.
And because of this income, when they go to apply, this client, when they go to apply for food stamps, they only get $75 a month.
Yo tengo que ver dónde están los mejores precios para darle de comer al mes. Y también a estas personas miro un poco ridículo porque ella tiene que pagar student loans todavía.
And not only that, but this woman also is still paying off her student loans, this 75-year-old woman.
It's wrong. I believe it's wrong. También el sistema de salud para los hispanos, a pesar que tenemos una comunidad grande, solamente en 200 y tantos clientes que tiene la compañía, solamente tenemos unos 4 o 5 hispanos.
¿Puedes repetirlo? ¿Puedes repetirlo?
Oh, sí. En el trabajo que yo hago, a pesar que tenemos una comunidad hispana de grande,
I'm sorry, got it. In the work that I do, I also want to be very clear that all of the people that I work with, and despite living in a community that's largely Hispanic, very few of my clients are Hispanic. Most of them are American-born folks.
Creemos en atender nuestras personas. El problema de salud es malo. Muchas de nuestros gente mayor regresa a sus comunidades.
And in my community, a lot of us believe in taking care of our seniors, and so when they're older, actually it's better for them to go back to their own country because the healthcare system here is so broken.
Amamos mucho este nuevo presidente que tenemos.
In Mexico, we love our new president
porque es honesto y cree en ayudar a nuestra comunidad.
because he's been honest and he believes in helping the communities.
Ahora tienen free health care para personas mayores.
And now they all have, in Mexico, you can have free health care for all seniors.
Mi esposo y yo tenemos el mismo problema que ustedes con el sistema de salud.
Me and my husband have the same problem with the broken healthcare system.
Mi esposo tiene que agarrar 3 veces por año el examen de la vista porque tiene glaucoma.
My husband 3 times a year has to take some sort of healthcare exam because he has glaucoma.
Even ahora tiene 66 años, tenemos que pagar 2 visitas extra nosotros de nuestro paquete, aparte de lo que pagamos de copays y todo.
And even though he's 76 years old, we still have to pay out of pocket for 2 of those 3 visits.
Las medicinas son caras, lo que dice Bernie es increíble, ojalá.
And the medicines are very expensive, and what Bernie is talking about would be great.
Yo creo que en esta comunidad nuestros jóvenes hispanos van a hacer la diferencia en el futuro.
I believe that in this community, our young Latino community members are going to make a difference in our future.
Y solo mi hija, la más chica, quiere ser doctor y alguien ingeniero, y todos mis hijos son personas trabajadoras de esta comunidad muy reconocidas.
All of my children are really hardworking. I have a daughter who wants to be a doctor and a son who wants to be an engineer.
Y tengo muchos nietos, como 20 nietos.
And I have 20 nephews and nieces.
Algunos
Or
adoptados.
grandchildren. I'm sorry, grandchildren.
See, at no additional cost, we're getting a Spanish lesson. Part of our campaign.
Por favor.
Y pues, gracias a todos por escucharme. Y
Thank you
creo,
for everybody for listening to me.
miro muchas caras que me conocen y yo soy muy feliz de vivir en este pueblo.
And for all of you who know me, all the faces I see that know me, I am so happy to live in this community.
Sé que son buenos en esta comunidad.
I know that we're good people in this
Y
community.
trabajamos juntos.
And
Por
we work
eso-
together.
Por eso queremos un cambio y vamos a apoyar a Bernie.
And we can work together, and for this reason, we need to support Bernie.
Thank you. Ramona, can I ask you a question? And you don't have to answer it. We talked about it before. Would you tell people how much you make per hour doing the very, very important work you do?
Yes, I make $12 for homemaking plus, y I do home health aid like CNA job. I make $20. So last week I worked in 40 hours home health aid plus 20 hours homemaking. And I don't receive any gas miles or maintenance for my car. I have to have good car. If I don't have good car, I don't work. My economy is bad most of the time. I working because I really love my job. I don't believe myself stay at home. Too many people need care. And I really like provide that care.
Ramona, thank you so much for what you do. Here's an example of something. You know, here's an example of a beautiful, caring woman who makes $12 an hour, who sometimes buys food or gets food to bring to her clients because they're even worse off than she is. All right? So what we heard is her going out to take care of people who somehow or another are trying to make it on $1,100 a month. Think for a moment, how as an elderly person do you possibly make it on what amounts to $12,000 a year? How do you do that? You don't. I mean, it is literally beyond comprehension. So I want to thank Ramona for telling her story and for the important work that she is doing. All right, let me just say a few words about health care, and then we'll open it up for questions and comments. How many people know how many major countries on earth do not guarantee health care to all people as a right? Anyone know? Yeah, the United States. Okay. So we have got to ask ourselves, question number one, how it happens that Canada, and I live 50 miles away from Canada, if you go into a hospital in Canada and you have heart surgery, what's the bill when you come out? Anyone know? Zero. You can run up would be a $100,000 bill in this country and pay it off forever, but in Canada it is zero, and that is true in most major countries on earth. Canada and many other countries, you go to the doctor that you want to go to. You're not limited by your network, and you often do not have to take out your wallet when you go to the doctor. So we have got to ask ourselves why that is the case. And here's something else that we have to ask ourselves, which we don't talk about too much on TV. We as a nation, despite having 34 million people uninsured and even more underinsured with high deductibles and copayments, we pay the highest prices in the world by far for prescription drugs. At the end of the day, our system cost us twice as much per capita on health care as do the people of any other country pay. Twice as much. We are spending now close to $11,000 per person on health care, and it is projected to go up. Why is it that we end up spending so much more on health care as the people of any other country? Who has some thoughts on that? Yes, gentleman, the blue T-shirt.
I suppose there's probably quite a few variables that affect that, and perhaps this isn't the venue for it. But one of my questions was, as it relates to healthcare, on the other side, that healthcare, is kind of the firefighting part. I'm kind of curious as well about the fire prevention. What would a Sanders administration do in terms of, because a number of those other nations do a number of things to make their population healthier.
Absolutely.
So that healthcare isn't even, as important.
Okay, stay on that one. I'll get to that in a minute. Questions, what is the function of the American healthcare system? This gentleman, what's your name, sir? Aaron raised a good question. He said, do we do enough in terms of keeping people healthy, disease prevention, right? Okay. But what is the function? Is the function of this system to try to keep people healthy and to prevent disease? What is the ultimate function of the current money and... Okay, stand up, give this, we got a mic here.
The ultimate goal of any corporation, particularly healthcare corporations, is to make as much money as possible so that stockholders can make money. And of course, when you make money, you buy the stocks back for those in the company, so fewer and fewer people are accumulating all that money, which is possibly not the best and highest use of a healthcare system.
No, that's exactly, I'm sorry, your name is?
I'm Cornelia Flora.
Okay. Well, what you just said is exactly, in my view, right. Top 5 insurance companies made $20 billion last year. You guys are in Iowa familiar with United Health, right? I don't hear a lot of enthusiasm for United Health. Well, you'll be happy to know, see, I'll make you more excited now, that the guy who's head of United Health has a compensation package last year of $83 million, okay? And I'll tell you another story. It's a guy named Mr. Bertolini, who is the head of Aetna, another large insurance company. Aetna, as you know, merged with CVS drugstores. Take a wild and crazy guess about how many healthcare dollars Mr. Bertolini received for engineering this merger, which will probably raise healthcare costs. Anyone want to guess? Answer, $500 million. All right. So your point is exactly right. Look, it's not complicated. The function of healthcare in America is to make as much money as possible for the insurance companies, for their stockholders, for their CEOs, and for the drug companies as well. Please. No. Go right in. We've got a mic up here.
And it's what's on television, it's what advertises to the children, and it's what the lady said, that's the nurse, that all these children with bad teeth, rotting teeth, and you see it, any picture of Kentucky shows these children with these rotting teeth, and it's supposed to have the poorest, it's the poorest state, or one of the poorest states in the country.
Hold that mic to you.
Okay.
You're doing good. I don't want to stop you. You're on a roll here.
Well, but it's true, and it all comes from the corporations, and you can't make people understand that.
All right, here's what, that's right. No, you're not sorry. That's exactly right. And here is where a unjust healthcare system, a dysfunctional healthcare system, bumps into a corrupt campaign finance system. Because the insurance companies and the drug companies will spend a fortune on campaign contributions to elect people who will reflect their interests, and also they have a zillion number of lobbyists all over Washington and in state legislature. I see a hand over there.
Thank you. My father has stage 4 prostate cancer. partially that came about because they had what they used to call catastrophic health insurance, which now we call HDHP, or high deductible health plan, which sounds nicer.
Some of us call it junk insurance. How's that?
Yeah, so he didn't find it until the cancer was everywhere. And they're frugal people. They don't have a lot. And my mom is trying to figure out, where they can go, where they might pay the least. And I just watched a doctor talk about working in a hospital where there were 1,000 doctors and 3,000 administrators. It took 3 people for every 1 doctor because of the paperwork spaghetti that we have. And yet, if you go into any hospital and you say, what am I going to pay for X procedure? 99.9% of the time, no one in that hospital knows.
Okay, you raised a good question. And the question is, when you have a dysfunctional healthcare system, which is designed to make money for insurance companies and drug companies, it becomes, by definition, extremely complicated. So if somebody walks in, we heard a story earlier about somebody receiving a huge hospital bill, you're going to need a lot of people to figure out how much that bill will be, and when that bill cannot be paid, you're going to have a whole slew of folks on the phone bombarding somebody to make sure that they pay that bill, driving that person kind of crazy. The estimate is that we waste about $500 billion a year on all of that administrative stuff that you're talking about. A sensible healthcare system puts its money into doctors, into nurses, into prescription drug research so that we get the best drugs available, into disease prevention, into ways to keep people healthy. What is the incentive right now for the insurance companies to put money into disease prevention? Not a whole lot. All right? The incentive is to get people into the hospital where they can make a very significant amount of money. All right, so the bottom line is, and here the good news in a sense is we don't have to reinvent the wheel here. Other countries are already doing the right thing. And that is, number one, healthcare is a human right. That means that everybody is entitled to all of the healthcare that they need, comprehensive healthcare. The Medicare for All bill that we are fighting for right now, among many other things, will provide dental care for seniors and for everybody. It will provide hearing aids. It will provide eyeglasses as well. It is comprehensive health care. You will have freedom of choice regarding the doctor or the hospital you want to go. To answer Aaron's good question, obviously the function of any serious healthcare system is to keep our people well, is to prevent disease. So you have dental care when children need it so they don't get infections and get sick later. You have a strong primary health care system. We are way behind other countries around the world in making primary health care accessible to people. So if you can't get to a doctor when you should, you end up getting sicker. And the next time you go into a doctor's office, ask him or her how many patients they have lost who walked into their office too late because they did not have health insurance or the deductibles or copayments was too high. So the reason that we are spending so much per capita on health care has to do with the greed of the insurance companies, an enormously complicated system which requires all kinds of bureaucrats to figure out what we pay and how we're going to bill people. And by the way, these bureaucrats in the insurance company are also driving doctors and nurses crazy, because a doctor wants to go prescribe a certain therapy to you or a certain prescription drug to you, and he or she has to clear it with the insurance companies. It takes an enormous amount of time. And you're finding doctors burning out. You know, they went to medical school, the best, to treat people, to get them well, not to be spending half their life arguing with insurance companies. All right, and many of them are sick and tired of that whole experience. So what I am fighting for is a simple system, a comprehensive system, a system that will in fact save people money, because we're going to do away with that $500 billion a year in wasteful administrative cost, a system that puts its focus on primary health care and doing our best to keep people healthy rather than treat them at great expense after they are very, very sick. And what I want to tell you all is that in our struggle for a Medicare for All system, we are making enormous progress. When I was here in Iowa 4 years ago and I raised this issue, not a lot of people in America even knew what I was talking about. 4 years have come and gone. Last poll that I saw, 70% of the American people support a Medicare for All single-payer system. But what I want to tell you is the opposition to our going forward is going to be incredible. They will spend hundreds and hundreds of millions of dollars. Mark my words. Here in Iowa, you will see 30-second ads attacking me personally and attacking the concept of Medicare for all. And they will lie. All right? They will lie. At the end of the day, for the pharmaceutical industry and for the insurance industry, this system works just great because they make huge profits and their CEOs get huge compensation packages. But for the people up here and for the vast majority of the American people, this system does not work well. So our job is to take on the insurance industry, take on the pharmaceutical industry, and to say loudly and clearly, healthcare is a human right, not a privilege. And if every other major country on earth can do it, and they're all a little bit different. Each country has a little bit different system, some stronger, some weaker. But if every other country on earth can guarantee health care to every man, woman, and child in their country, don't tell me the United States of America cannot do the same. Thank you all very much.